Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical, and I'm coming on here to talk to you about our topic this week. And actually what we're going to do is we're going to have a two-part series to this video, and we're going to be talking about tennis elbow. And a lot of you may have heard of tennis elbow and what it is, and that's what I'm going to discuss. And then next week we're going to tune back in and I'm going to go over what you can do at home, some exercises to actually treat it, and what we do in the office as far as effective treatment. Now, what is tennis elbow? Okay, and so I brought a picture up here, and even I'm going to show you a little bit of what happens in tennis elbow, and they call it in the medical world lateral epicondylopathy. And so what it is right here when you have overuse, you actually start disrupting the tendon and muscles that attach right here on the outside of your elbow. And it's actually the most common cause of elbow pain, if any of you didn't know that. And so it doesn't normally happen due to trauma, although it can. It actually happens to years of overuse. And so what's really common is if you type a lot, anything when you go into extension, it'll stress that over the years if those work modifications are not altered, and it goes through and it'll stress the outside of your elbow. And so right here in this picture, you can see right here is the common site to where it gets irritated. And so the first step of any treatment, I'll go into this more next week, is to first just modify your activities and what you do. So if you do a lot of typing, work at your workstation to modify anything to go into that hyperextension. And then you also just want to look at your grip strength, because these wrist extensors can also cause that irritation there. So I hope this was informative. Be sure to come in this week and grab the handout, and then tune in next week and we'll demonstrate some simple exercises you can do at home. Alright, hope you have a great week.